Tip 1. The most obvious but difficult tip to follow is to listen to your patient and stop talking. The pre-treatment consultation is a pivotal point in the patient's experience at the practice. Studies show that practitioners tend to only allow their patients to speak no more than 12 to 18 seconds before interruption. This can easily sabotage new relationships between the patient and the practitioner. It's the first major step towards gaining information that enables you to develop safe, successful, and appropriate treatment plan. It also allows you to gain insight to the patient's goals, motivation, and their expectations. Hi Anne, my name is Sarah Jane and I will be doing your consultation today. I'd just like to go through and get a better understanding of what your concerns are with your skin.
Absolutely. So I started getting melasma on my forehead probably about 7 years ago. It started with a little line and then it progressively got bigger. You can't really notice it as much in the winter, but in the summer, as soon as I start tanning, it's really obvious. So that kind of bugs me.
Yeah.
I get told I'm tired a lot because of the dark circles under my eyes. I frown a lot, so I have like my forehead and around the sides of my eyes.
And then I'm starting to have a little bit of dark spots as well on my cheek. And then as I'm getting older, my skin's not as puffier as I'm starting to get lines by my lips.
Just not feeling as youthful.
Exactly. And then just the elasticity of my skin is not what it used to be. And then I have some deep lines in my forehead too that I wouldn't mind getting rid of.
The success of a consultation relies on creating a positive, trusting relationship. Allowing patients to speak without interruption enhances patient satisfaction and the efficiency of the consultation. The patient will feel heard, respected, and a solid foundation of trust has begun. Remember, the consultation is not about you. Focus on your client's goals, motivations, and their expectations. Use your expertise to help guide them towards the best steps for achieving it, rather than pushing what you believe to be the better outcome. Tip 2. Building credibility with your patient through knowledge, enhancing their confidence in the practitioner, treatment plan, and the prescribed products. As you lay out their treatment plan, be honest and forthcoming about the plan, recovery time, and what the client can expect to experience before, during, and after. Building a comprehensive protocol that your patient is comfortable with. Develop a treatment plan with the patient. Bring the nurse or the laser tech in to discuss treatment options.
I just want to have a little bit of a conversation with you of expectations, what you're going to feel and look like during the treatment, your post-procedures. I want you to let me know if you have any questions about the actual treatments that we're going to be providing for you today as well.
Okay.
So what we're going to do is a treatment called fractional skin resurfacing, and that's going to help manage and tone down the pigmentation.
So I'm just going to sit down with you today and discuss a little bit more in depth about the treatment options for you and answer any of your questions with regards to that. So the fillers that we use are from the Teosil brand, and primarily they are hyaluronic acid based. Hyaluronic acid is actually naturally produced by your body, so it is in a sense a natural substance that we are injecting. It's considered to be more of a natural treatment. What happens as we age over time is we lose the ability to effectively produce collagen, which is stimulated by hyaluronic acid. So when we inject fillers, we help to stimulate that collagen production again over time. That would be the more long-term benefit. In terms of short-term, you get that immediate volumization effect, which gives you that instant gratification.
For your nasolabial folds, also known as laugh lines, what we're doing is we're going into the mucosa, we're tightening up collagen and elastin so that your lines become softer and you'll feel a pull come up on your cheekbone as well.
I've never done this before, so is there a lot of pain involved?
That's a great question. Pain is a very subjective thing, so it's hard to say, for sure whether you're going to feel any pain. But I can tell you, generally speaking, with most of my clients, in terms of neurotoxin treatment, it's considered to be a relatively painless procedure. It's quite quick, and most of the needle pokes are quite superficial.
Awesome. And how painful is it?
The intraoral is like a hot stone massage. You hardly feel it.
Okay.
Your fractional skin resurfacing, we're going to numb your skin.
Okay.
So your pain tolerance probably out of a 10 will be about a 4 or 5.
Oh, okay.
Okay,
That's not
very
too bad.
manageable.
All right, sounds good.
Yeah.
Tip 3, taking an effective baseline photo. Make sure that the patient signs a photography consent form. Once you have established what the main concerns are of your patient, taking a baseline photo will allow you to confirm that you and your patient are on the same page. Baseline photos are useful to assess the progress and changes over time, as the patient can become quickly used to their enhanced appearance. Tip 4, use UV lighting tools to highlight unknown concerns. UV lighting exaggerates patient skin concerns and can often highlight new skin concerns that your patient may not have originally noticed. This is a great way to allow your patients to recognize their own concerns without having to tell them directly. This is a great tool to use to upsell your treatment protocols and your skincare products. Tip 5, enhance results with an at-home skincare regime. As practitioners, we have expert advice to share with our clients, and they look to us as trusted advisors who can help them with their skincare so they look and feel their best. Assessing the patient's at-home regime is important to understand what they're using, but also finding the gaps. It will allow us to determine if there are any products they should discontinue prior to treatment, and it can sometimes be the root cause of their concern. A well-prepared skin will respond better to treatment, heal faster, and may have less complications. Patients need to protect their investment with good skincare, a routine as well as a daily use of SPF. So post-procedure, as a reminder, you're going to be using our micellar wash from Teoxane. So this has an antibacterial in it as well. It's a wipe. You're just going to cleanse the face twice a day to make sure that you're keeping your skin clean as well. Following that, we have a deep repair balm by Teoxane as well. So you're going to leave with that as part of your home care package. It's extremely important that you're wearing your sun protection factor. So we have included in your package for you as well is we have the Color Sign Sun Forgettable Brush On Sunscreen. It is a mineral SPF 50, so it's going to sit on the skin and protect you from the ultraviolet rays from the sun. So it's really, really important that you do that and make sure that you're wearing that during the day as well. I am also going to include a hydrating mist for you as well. So after treatment, the skin is going to feel, as we mentioned, a little tight. So you can kind of just spritz the face with that and just giving yourself some moisture throughout the day. This is a vital part of your treatment plan. This part of the consultation may be difficult for some practitioners as they feel they are selling to their patients. Often I personally, and I'm sure you will all agree, have heard from some practitioners, I'm not a salesperson. However, it is our responsibility to help our clients get the best results from their treatment plan, followed by the right treatment options. Listen to your patients, watch them, and determine the best approach to building a long-lasting relationship.